The mitral valve is located in the left side of the heart. It's one of the main valves of the heart because it's exposed to like a lot of pressure. The mitral valve is a very complex valve that we're able to repair or replace. So when it fails, we do have the ability though sometimes to do a minimally invasive procedure in which we can go into the left side of the heart through catheters and repair it. By that, what we usually do is put a clip or two clips that are specially made for this reason, and those clips actually help the valve close better when it needs to close, and it still allows the valve to open when it needs to open. Replacement is a little bit different. Sometimes the valve is very diseased, and we have different valves here at Henry Ford that we work with that we can place through catheters and put a new valve instead of just repairing it.